another episode of the Yaba Voice webinar. So good morning, good afternoon, good evening from wherever it is that you are joining us from. And this month is very significant to us. It's the month of October, but it's also the Mental Health Month. Yes, it's a month where we celebrate the Mental Health Day. It's very, very germane. Because this year, they're talking about something very, very significant. We're talking about rights. When you do not know your right, abuse is inevitable. Then anybody can take you for granted and anything can happen to you. But before I run off, the medical director and the hour head of the Yaba Voice, Dr. Lubenga Dekileweye, is ready to welcome us formally to this webinar today. Over to you, Dr. Weye, sir.
Thank you very much, Dr. Mrs. Kemi Akitoyese. Good afternoon, everyone. I warmly welcome you to this month's edition of webinar by Yaba Voice. Yaba Voice is a platform for mental health education, advocacy, and community outreach. It is a social media platform of Federal Neuropsychiatric Hospital Yaba, Lagos, through which the hospital creates awareness and educate the populace on mental health issues. So this is a universal human right. Mental health is a universal human right. As we all know, the World Mental Health Day, year 2023, is an opportunity for people and communities to unite behind the theme, mental health is a universal human right. Just to improve our knowledge, raise awareness, and drive actions that promote and protect everyone's mental health as a universal human right. Mental health is critically important for everyone, everywhere, and goes beyond the mere absence of a mental illness. It is integral to well-being, enabling people to realize their full potential, show resilience amidst adversity, being productive across various settings of daily life, and for meaningful relationships, and also to contribute to their community. In today's webinar, there are many questions to be addressed. For example, what do we understand by mental health and mental ill health? What are the rights of the mentally ill? How important is human rights in mental health? What are the factors mitigating mental health? And how do we promote good mental health? To address this issue today are great mental health experts. The first on the list is Dr. Olufumilayo Akinola. Dr. Akinola is a chief consultant psychiatrist with over 25 years of psychiatric experience. She is involved in the hospital community, education, outreach programs, psychiatric rehabilitation, advocacy, and clinical practice. She's a fellow and an examiner of the National Postgraduate Medical College of Nigeria. She's a NEPOSH internationally certified operational and safety specialist and an astute hospital administrator. Dr. Akinola is the current secretary of the Faculty of Psychiatry of the National Postgraduate Medical College of Nigeria. She is also the chief consultant in charge of the Federal Neuropsychiatric Hospital, Oshodi Annex in Lagos. Our passion include mentoring adolescents and youth, speaking at seminars, conferences, and also she's interested in traveling and reading. Our second presenter in today's program is Mrs. Mavis, okay? Mrs. Mavis, okay, is an assistant director of nursing at Federal Neuropsychiatric Hospital, Yaba, Lagos. She holds Bachelor of Nursing Science. She's a registered mental health nurse. She's a registered midwife, and she's a registered nurse. She also has certificate in leadership and management training. She's a member of Implementation Committee for Nurses Continuing Education, Lagos State Chapter. She has over 25 years of experience in nursing management of patients. She also has over 20 years of experience in management of patients, coordinating, developing, and implementing evidence-based care plans that improve patients' health. Mrs. Oke also has over 20 years experience in management and promotion of mental health. I want to kindly encourage you to relax and listen to our mental health expert as we promise you a rewarding session of today's webinar. Over to you, Dr. Mrs. Kemi Akitoyesi.
Thank you, Medical Director, sir, for that arousing welcome. And the Medical Director had started this conversation for us by telling us what to really look forward to in this conversation this afternoon. But please, if you know somebody that needs to be here, kindly connect with them. The issue we are talking about is an issue that concerns everyone. It's not just an issue for a group of people. Gone are the days where we think mental health is low or local or whatever it name that we have for it in our own culture or other place. It's a conversation for everyone. We must know our right to be able to safeguard ourselves and then to be able to protect ourselves and to be able to maximize this right. And the medical director have done that for us. So please, if you know someone who needs to be here, kindly reach out to them. Again, if you also know that, it's difficult for you to join here on the Zoom platform, please link up with us on Facebook. We are streaming live. You're also on the Facebook app today. So now let's go quickly. We have just 1 hour to the conversation for the day. And Dr. Akinola will be starting the conversation for us by telling us exactly what is mental health and how does it implicate or affect our functioning. When we talk about mental health, what are we talking about? And what's the implication on our functioning? Over to you, Dr. Akinola.
Thank you very much, our doctor in the house. Thank you very much, Medical Director, for that introduction. Well done, sir. So good afternoon, everybody. Thank you for giving me this opportunity to be here today. So we're going to talk about what mental health is and why is it important. Okay, so maybe I should start with statistics, a little bit of statistics. We do know that 1 in every 8 person they're living with mental health conditions all over the world. And you know that if our mind is not good, it's not in tip-top condition, then it affects our physical health, our well-being, how we connect with others, and how our level of functioning in the community, even in our homes, and the community in the place where we work. And we know that about 50% of adults that eventually have mental health problems, the issues will have started in adolescents around the age of 15. So this is very, very significant. And we know that the children, what is the population of our adolescents now? It's quite a lot. I don't want to quote the wrong statistics, but we do have that, the bottom of the pyramid is quite large. So we need to pay attention to this, our adolescents, and of course, the adults. So that is why, and if the mind is not functioning, that there's no health without mental health. So that is why it is important that we have to continue to talk about mental health advocacy, give education, appropriate education, so that people know what is going on. And the idea is, in medicine, we talk about early identification, early referral, treatment, and to prevent disability. So if we can all pick these symptoms, if there's going to be any mental health problems, pick it early, do the appropriate referral, then treatment will be started. So let's take a little bit of definition. So what is mental health? Well, to say it, we know that WHO, the definition by WHO says, mental health is a state of well-being in which an individual, male or female, realizes his or her own abilities. We must know what we can do. What am I good in? What are you good in? What is the next person good in? So it is these abilities that we should focus on, not the short ones, the shortcomings that we are not particularly good at. So we must be able to realize that capacity to realize what I can do, what I cannot do. Can I cope with normal stresses of life? Can I work productively and fruitfully wherever I find myself? Is it a student in school? Is it in the marketplace, in an organization, in working environment, and particularly in our homes? So can I work productively, fruitfully, and I'm able to make contribution to wherever I find myself, the 3 domains of life. So this, in essence, is the definition for mental health. And you know that some words are very significant in that definition. For example, well-being, to know your abilities to work productively and contribute wherever you are. So let's define what well-being is. We know that mental well-being is all about our thoughts, our thinking abilities, then the feelings that we attach to these thoughts, and of course, ultimately, how we now behave and how we cope with the difficulties of everyday life. And are we able to achieve our personal goals? So if there's a problem anywhere along this area, is it thoughts, is it our thinking pattern? You plan and they can't achieve the goals and the person is not productive. I've had a patient that the only symptoms he had was that he would just be working. He was not working. He didn't go to school. But even the working, he would just be working in the village and he would not work on the road or the pathway. He would be working at the edges of people's houses and he was not productive. So you see that it doesn't really have to be something very significant or very disruptive. And so once somebody cannot achieve personal goals, if anything happens along this line, thoughts, thinking, feelings, our behavior, what is the person able to do? Then we begin to think, is there something wrong? Please don't go around making diagnoses on people. The important thing is to help the individual to seek for early assessment. So we'll be able to make, if it is possible, is it diagnosis? Is there a problem? Then if there's a problem, then we know where to refer the person to. So in essence, our well-being talks about encompassing our physical, our social life, our ability to be happy, our ability to be healthy, to be socially acceptable and connected. It is so important. And to be purposeful in life. So in a short word, that is what mental health is all about. Thank you.
Thank you so very much, Dr. Akinola. I love how she started. And it's giving us an insight into the fact that what we're talking about is not just for adults, it's for everyone. The matter of fact, adolescent age is a precursor for what we are looking at. So if we would begin to make adequate understanding of this subject of discussion today, you need to start looking at it from way back. So everyone needs to get involved. Thank you so very much for that submission, ma'am. I'm going to go over to Mrs. Marvins, but please let's note, we are having some bit of technical issues with our Zoom. We don't know what is happening. They're trying to work really on it. But if we ever get logged out at any time, please kindly rejoin. We don't know what's happening, but please, if you get logged off, please just kindly rejoin. We are trying to resolve it as much as we can. Thank you so very much. All right, so please let's look at what are the factors that mitigates against our mental health, especially in our culture, in our environment. What are those factors which are challenge or don't disturb our mental health? Over to you, Mrs. Marvins. Okay, I hope she's back quickly. We know that some of those things are not things that we can control. The most important thing is to be able to understand that there are things that you cannot control that tends to happen around you. She would rejoin us shortly. Looking at this very important topic of discussion, we must understand the things that can affect our mental health. Over to you, Mrs. Okay, thank you, ma'am. Mrs. Okay, you have the floor.
Thank you. Yeah, thank you very much. Good afternoon. Thank you for having me here. We can see that there are so many factors as we can see that our mental health is very, very important. And
please check your wireless so that we can hear you very well. Mrs. Okay, check your wireless. It's making a cracky sound so that we can hear you very well. Okay. Hello, it's still making that sound so we can be able to benefit very well. Maybe check the inputs. All right, please go on. Hello, yes, you're good now.
All right, thank you very much. All right, thank you very much. Well, as we can say, as Dr. Akinola has rightly defined what mental health entails, and she has told us that it doesn't have to just be an adult. It affects both adolescents, even the teens, the adults. We have so many factors that mitigate against our mental health. And these factors make it very difficult for individuals to live a mental, well-being or a balance. And that is why we have to, consider some of these factors and see what can affect us. We have biological factors, and in these biological factors, we have genetics, whereby there is a family history of mental health disorders in the family. In any family that has a family history of mental health disorder, individuals in that family are susceptible. It is likely to reoccur. It may be in the next 2-3 generations. That is genetics. Then we have imbalanced neurotransmitters. These neurotransmitters are brain chemicals that function normally and help the body, the individual to perform some specific roles. When there is imbalance, we have dopamine and serotonin. When there is imbalance, there is likelihood to trigger mental health issues in individuals. Then we have environmental factors. In these environmental factors, we have some hostile environment, and we have some children that are going through traumatic experience. Child labor is there, bullying is there, children that have lost their parents and there is no support, children that are neglected. When we are talking about the young ones, the adolescents, all these traumatic events can trigger a mental health disorder in childhood and even in adults. And then we have stress, chronic stress. As we can see, we are all going through stress in this nation. Not just this nation, there is stress everywhere. There's nowhere you will go to. There is global meltdown, there's economic challenges. So there's work stress, there is educational stress. When the expectation, parents are expecting more or expecting more than what the children can academically, and they are put on pressure. There is stress coming to work every day. And when you are being overwhelmed and you cannot manage it successfully, it leads to breakdown. It brings anxieties, worries, and frustration. So we have stress, and relationship stress is there. Relationships that are toxic, homes that are going through challenges at the edge of breaking, and the partners, the spouses are going through stress in maintaining that relationship. Then we have loss of loved ones. That is lifestyle events, loss of loved ones, loss of business, loss of job, financial challenges, social isolation, and all this triggers mental illness. All these compounded, our health factors. They have socioeconomic factors, like I rightly said, that can affect or mitigate our mental health. They are there. Well, then this social status. I've seen a situation where a child, was in a family, they are low income and visited the auntie. They are very well to do. And according to the child, a long distance relation came around and knew that she is a member of that family, has been related to that family. I was asking the younger one in that family, is this your new house help the new house help that your mother had just employed? She said she broke down totally, went throughout, and she saw herself as a low entity. Her self-esteem was demoralized. Things like this triggers or mitigate against our mental health. Then we have some cultural differences, some harmful cultural practices that affect our mental health, Some cultures
Okay, I think we lost her, but I'm sure she's going to back. Is she back? Okay, she's back now.
Yes.
All right, continue, please.
Yeah, sorry for interruption. So we talked about this social.
We apologize sincerely for that break.
Sorry, are you hearing me?
Yes, we can hear you now.
All right. Think about social cultural factors that affect our mental health. Like in some families or in some cultures that they make it. The one is put under pressure, trying to make sure